Student, good day. Topic of our lectures today, it's acute abdomen. And now we start our lectures. The acute abdomen is defined as a sudden onset of severe abdominal pain of less than 24 hours duration. It has a large number of possible causes, and so a structured approach is required. The initial assessment should attempt to determine if the patient has an acute surgical problem that requires immediate and prompt surgical intervention or urgent medical therapy. The acute abdomen. Acute abdomen is defined as medical condition which is caused by acute destructive abdominal disease. On this slide you can see some disease, some destructive disease, appendicitis, acute cholecystitis, another disease. And on last slide I show you this disease. This disease have similar symptoms. It is complicated by internal bleeding or peritonitis. This condition requires emergency surgical intervention. Now, for example, in this slide you can see some disease and localized this disease. In the upper level you can see the cholecystitis, cholangitis, pancreatitis in here, and a lower part of the body, appendicitis, diverticulitis, and Avarium Torsion. It's only some disease. Student, in this slide you can see the more commonly localized symptoms of different disease. And now I can show you the, for example, epigastrial region. Epigastrial region, you can see our arrow in here. Epigastrial region in here, and maybe peptic ulcer disease, maybe symptoms of cholecystitis, maybe symptoms of pancreatitis, and myocardial infarction. Now is the right region, upper lower of the abdomen, to cholecystitis, pyelonephritis, ureteric colic, hepatitis, and symptoms of pneumonia. In left upper region of abdomen, you can see, for eczema of the patients, you can see the symptoms of gastric ulcer, pyelonephritis, ureteric colic, and pneumonia. Periumbilical region in here. You can see my arrow, and I show you the area region of periumbilical. And in here you can see the symptoms of the small bowel obstruction, a large bowel obstruction, appendicitis, and abdominal aortic aneurysm in periumbilical region. And the lower part of the abdomen, you can see in the right side, you can see the symptoms of appendicitis, ureteric colic, Так. Ureteric colic, inguinal hernia, ABT, UTA, gynecological and testicular torsion. And the left side, you can see the symptoms of diverticulitis, ureteric colics, inguinal hernia. 2 is ABT and UTA, gynecological and testicular torsion. It's a region when we can find the symptoms of other disease. Next slide, you can see the definition of acute abdomen, cause of acute abdominal pain. And group of acute abdominal pain, it's group of acute destructive abdominal disease that have the similar symptoms and are complicated by peritonitis or bleeding and require surgical intervention. It is more important definition of acute abdomen, and you must remember this. Student, in the slide you can see the destructive abdomen disease. At the first, this acute appendicitis. Next, it's acute peptic ulcer and its complications. Acute peptic ulcer and its complications. Next disease is acute cholecystitis, acute pancreatitis, acute intestinal ischemia, see a section below, acute diverticulitis, ectopic pregnancy with tubular rupture, Avarium Torsion, acute peritonitis, including follow viscous perforation, bowel volvulus, bowel obstruction, abdominal aortic aneurysm, hemoperitoneum, and rupture of spleen. Student, it's disease, destructive disease of abdomen, which can lead to acute abdomen and peritonitis and internal bleeding. And now I show you this disease. Now, for example, in the slide, you can see the acute appendicitis. Now you can see some anatomy of appendicitis. In the slide, you can see the small bowel, large bowel, at the beginning of large bowel, at the end of small bowel. In here you can see the appendix. But very often its appendix can be inflammation. And this disease called as appendicitis. It's acute destructive disease, and this disease can lead to destructive inside the abdominal cavity and complicated by peritonitis. Next disease, you can see the peptic ulcer disease. Other name is disease peptic ulcer, stomach ulcer, gastric ulcer, and duodenal ulcer. And uncomplicated ulcer cannot lead to complications, but only complicated ulcer, gastric ulcer, can lead to complication with peritonitis and maybe internal bleeding. maybe internal bleeding. Now, I can show you the important symptoms of rupture of the ulcer, rupture of the gastric ulcer. Student, commonly on the X-ray, you can see the symptoms. Symptoms called as crescent signs. Crescent sign. What is it? Crescent sign. When we can see on X-ray free air under the diaphragm. Free air under the diaphragm. And this X-ray need to upright X-ray. When the people stand up front of the X-ray machine, and you can see the best demonstrated on the upright chest X-ray or left lat decube. Left lat decube. The more commonly we can use the upright chest, and when the patient have the heart condition and cannot stand front of the X-ray machine, we can use the raise left lat decube X-ray. And now I can show you where are the symptoms. On this X-ray, you can see the diaphragm. When I mark my arrow, this is a diaphragm, and in here you can see the shadows of the liver. In normal, you cannot see size between the diaphragm and liver. Cannot see the diaphragm. And now you can see the this size. Very, if you compare with moon, with Christians. And these symptoms are called as Christian signs. Okay, these symptoms define that this patient have the air, free air under the diaphragm. Free air. In this, you can see two Christian signs. And this patient have the free air under the diaphragm. Its symptoms find to this patient have the rupture of the ulcer. When the patient have a rupture of the ulcer, free gas pass inside the abdominal cavity, and when this free air pass inside the abdominal cavity, then this free gas pass up under the diaphragm, and the shadows of diaphragm and shadows of liver detachment. We can use the upright X-ray when the patient stand front of the X-ray machine. Student, next disease, acute abdomen disease, is acute cholecystitis. And this disease too led to peritonitis, a complication of this disease, peritonitis. Oh, peritonitis. Acute. In the slide, you can see the acute gangrenous cholecystitis. CT scan show localized fluid attention abnormality adjacent and gallbladder to gallbladder consist with the abscess. And this slide you can see the abscess in here, the black arrow, this abscess. Detect in gallbladder wall is shown perforation and here perforation, and white arrow show pericholecystitis inflammation leading to peritonitis. And this peritonitis, it's acute cholecystitis, and complication acute cholecystitis too led to a complication of peritonitis. Student, in this slide you can see the anatomy of gallbladder, and next complications of acute cholecystitis with gallbladder complication is impact gallstone. You can see in here gallstone inside the gallbladders, and if you one stone pass up in this in here gallbladder nick, it's obstruction on the gallstone, and these complications of cholecystitis with gallstone. And these two belong to the acute abdomen. This condition, acute abdomen. Symptoms of blood gallstone. No, very commonly symptoms is noise and vomiting. Next symptoms is belching. Jaundice when the gallstone obstruct of the ducts. Jaundice. Increased body temperature. The cholecystitis is bacterial inflammation, and when the patient has the acute cholecystitis, this patient has the increased body temperature. Next symptoms is flatulence. It's the important symptoms of gallstone obstruction. It's pain in the right hypochondrium. It's pain. It's weakness, heartburn. It's important symptoms of gallstones. Next disease, it's acute pancreatitis. And now I show you some information for this disease. Yearly, the yearly incidence of acute pancreatitis in the United States is approximately 70 new cases per 100,000 populations. And acute pancreatitis results in 100,000 hospitalization per year. 80% of cases of acute pancreatitis and are interstitial and mild. The remaining 20% are necrotizing and severe. Approximately 2,000 patients per year died from complication related to related to acute pancreatitis. Causes of acute pancreatitis in procents of the case. 45% is gallstone, cause of acute pancreatitis. 35% alcohol, and other cases, and 10% it's medications, hypercalcemia, hypertriglyceridemia, obstructive, and other case of acute peritonitis. Maybe trauma, maybe varial vascular, ischemic vascular, and other. And 10% it's idiopathic forms of acute pancreatitis. In this slide too, you can see the causes of acute peritonitis, and how I told you, the most case is gallstone and alcohol, and other case autoimmune problems, high levels of triglycerides, damage to pancreatitis during the surgery, maybe, blockage of pancreatitis duct, all common bile duct, and viral infection, such as mumps. Student, in this slide you can see the diagnosis of acute peritonitis. According to the ACG guidelines, the diagnosis of acute peritonitis is supported by the elevation of the serum amylase and lipase in excess of 3 times the upper limit of normal. And other methods, it's biochemical methods of research and radiological studies. We can use radiological studies, plain films of the chest and abdomen, transabdominal ultrasound, contrast enhanced computed tomography, endoscopic ultrasound, and magnetic resonance cholangiography, endoscopic retrograde cholangiopancreatography. This methods of research this acute pancreatitis and important symptoms of acute pancreatitis. The most common symptoms or signs include severe epigastric pain, radiation to the back, relieved by leaning forward, nausea, vomiting, diarrhea and loss of appetite, fever, chills, and hemodynamic instability, including shock. In several cases, may present with tenderness, gathering, and rebound. Signs which are less common and indicated severe disease include, it's the 2 symptoms, you must remember these symptoms. Gray tonis signs, gray tonin size, what is it, gray tonin size? Hemorrhagic discoloration of the flank, hemorrhagic discoloration on the flank. And Gallen's signs. Gallen's sign, hemorrhagic discoloration of the umbilicus. It's acute pancreatitis. Next disease is a small and large bowel obstruction. And at the first slide, you can see the small bowel obstruction, and in this you can see the causes of small bowel obstruction. Causes of small bowel obstruction include, at the first place, adhesion. Adhesion from previous abdominal surgery. Most common causes. Previous abdominal surgery. And now I can show you next slide. The adhesion most common cause abdominal surgery, and then next cause, this is adhesion. The adhesion when the woman have the pregnancy, and after pregnancy, this development of the adhesion. You can see in here abdominal cavity on the woman, and after giving birth, development of adhesion inside the abdominal cavity. Let's to see other cause of small bowel obstruction, and budded saturates, pseudo obstruction, hernias, Crohn's disease to lead to development of adhesion, and causing adhesions, all inflammatory structures. Neoplasm, benign of malignant neoplasm, and other cause, as a cause. Student, in this time I explain you how to make diagnosis bowel obstruction, and small and large bowel obstruction, and very important methods of diagnosis bowel obstruction is X-ray. And now I explain what type of X-ray we can use for make diagnosis. And in this slide you can see the upright X-ray. Upright X-ray when the patient stand front of the X-ray machine, and in this case all weight part of the body, for example liver tends pass down, and maybe you can see in this gastric, and fluid inside the gastric and the bowel fluid to go to down. It's upright X-ray. So very important methods of X-ray research. In this slide you can see upright abdominal X-ray, and this you can see the marks for X-ray machine, and the process of X-ray research. Okay. Так. Student, wait 1 minute. I try to show the methods of lateral, left lateral decube abdomen. Так. Now I cannot turn on this method, and now I explain on this slide. Decubitus abdomen signs we can use when the patient has the heart condition and impossible the stand front of the X-ray machine, and we can use the decubitus abdomen X-ray when the patient lay on the table in front of the X-ray machine. And this slide you can see two signs of decubitus abdomen signs. In the slide you can see the air fluid level, in here air fluid level. In upper side you can see the air, free gas inside the abdominal cavity. And this black arrow, you can see the air fluid level in here. These methods, upright and methods of left lateral decube abdomen, help us to make diagnosis. And now I show you next slides, and in the you can see these methods, lateral decube methods. In this you can see the in right side the liver and sheet of this liver, and in upper side you can see the free gas inside the abdominal cavity. Free gas is signs of the rupture of the follow organs. For example, the gastric, the bowel, and other follow organs which contain the air. It's free gas in the abdominal cavity. Bowel obstruction, also known as the intestinal obstruction, is a mechanical or functional obstruction intestines, which prevents the normal movement of the products of digestion, small bowel or large bowel. Signs and symptoms include abdominal pain, vomiting, and bloating, and not passing gas. Mechanical obstruction is the cause of about 5 to 15% of the cases several abdominal pain of sudden onset requiring admission to hospital. This you can see upright abdominal X-ray. In this upright abdominal X-ray demonstrating a small bowel obstruction. You can see the node multiplies air fluid levels, and now I can show you this. In this you can see the air fluid level. When we can see air fluid level, It's very important signs of bowel obstruction. Bowel obstruction, this fluid air level. Student, next disease led to acute abdomen is diverticulitis. And complication of diverticulitis, it's acute abdomen. No other name, diverticulitis. It's colonic diverticulitis and other showing multiply sponge, patches, diverticula. And here you can see the diverticulitis, diverticula. The diverticula appears on either side of the longitudinal vascular bundle, which runs horizontally across the specimen in an arc. The symptoms of diverticulitis is abdominal pain, fever, nausea, diarrhea, constipation, blood in the stool. And complications of the diverticulitis is abscess, fistula, and bowel perforation. When the walls of this diverticula is thin, and maybe can to lead the bowel perforation, diverticulitis. Next disease belong to the female disease of abdominal, and you can see the ectopic pregnancy. Ectopic pregnancy, as called as the tubal pregnancy. Laparoscopic wife looking down at the uterus, marked by blue arrow, you can see in here. And in the left fallopian tube, there is an ectopic pregnancy and bleeding, marked by a red arrow. In this slide, you can see ectopic pregnancy inside the tube. And this pregnancy led to rupture of this tube and rupture of this tube artery, and led to internal bleeding. You can see in here signs of internal bleeding. No specialty, it's obstetrics and gynecology. Symptoms of this disease: abdominal pain and vaginal bleeding. Risk factors can lead to this ectopic pregnancy: the pelvic inflammatory disease, tobacco smoking, preortubral surgery, history of infertility, and use of assisted reproductive technology. Diagnosis method: blood test for human chorionic gonadotropin, and ultrasound methods for diagnosis. It's ectopic pregnancy which led to the acute abdomen and internal bleeding. Next female disease, it's Avarium Torsion. Avarium Torsion is other names, adnexal torsion. Arteries of the female reproductive tract and urinary artery, avarium artery, and vaginal artery. And symptoms of avarium torsion is that pelvic pain, what, and complication, infertility. Usual onset, classically sudden. Risk factors is this disease: avarium cysts, avarium enlargement, avarium tumors, pregnancy, and tubal ligations. Diagnosis methods based on the symptoms, ultrasound, and CT scan research. Student, and abdominal trauma too very often led to acute abdomen. And now on the slide we can see the 2/3, it's blunt trauma, and 1/3, the penetrating trauma. And blunt trauma and penetrating trauma can lead to acute abdomen with the damage of inside organs in abdominal cavity. And now we talk about the peritonitis. It's very dangerous, very important, and very dangerous complications of acute abdomen. And what is it, peritonitis? Peritonitis is an inflammation of the peritoneum, accompanying not only by local changes in the abdominal cover, but also by several general reactions of the body caused by intoxication, impaired intestinal function, and vital organs. Peritonitis. In this slide, you can see the peritonitis other names is surgical abdomen and acute abdomen. Causes include perforation of intestinal tracts, pancreatitis, pelvic inflammatory disease, stomach ulcer, complication of stomach ulcer, or rupture appendix. All disease we can say before this time. All disease can lead to peritonitis. Case symptoms of acute abdomen, and very important symptoms is abdominal pain. Abdominal pain. The main manifestation of peritonitis are acute abdominal pain, abdominal tenderness, and abdominal gagging and rigidity, which are exacerbated by moving the peritoneum. Coaching. Force coat may be used as a test. Flexing one's hips, all eliciting the Bloomberg signs. And now, student, I try to show these Bloomberg signs on next slide. Так. Where is this? No. Так. Wait 1 minute, student. Maybe I turn on this slide. It's video slide. Okay, let's explain you orally. What is it, Bloomberg signs? Meaning that the pressing a hand on the abdominal elicit less pain than releasing the hand abruptly. When we remove the hand, this pain more. When we pressure hand, the patient feels the pain, but less than we remove hands. It's called as a Bloomberg sign. Rigidity is highly specific for diagnosis peritonitis. Specificity 76 to 100%. The presence of these signs in a person is sometimes referred to as a peritonism. The localization of this manifestation depends on the whether peritonitis is localized, appendicitis, diverticulitis before the perforation, or generalized to the whole abdomen. In either case, pain typically starts as a generalized abdominal pain with involvement of poorly localizing visceral innervation and visceral peritoneal layer, and may become localized later with involvement of the stomach innervation of the peritoneal layers. Peritonitis is an example of the acute abdomen. Other symptoms. Diffuse abdominal rigidity is often present, especially with generalized peritonitis. Next symptoms is a fever, sinus tachycardia, heart rate, development of the ileus paralyticus, intestinal paralysis, which also causes nausea, vomiting, and bloating. Reduced or no passage of abdominal gas and bowel sound. It's other symptoms of peritonitis. Physical examination of this patient. In order to clinical exam a patient with acute abdomen, it is necessary to inspiration for injuries, all hematomas, hernias, other abdominal walls defects, all skin discoloration with pancreatitis. The stomach participates in the acts of breathing. Auscultation should always be performed prior to manual examinations in order to avoid provoking intestinal noises. Intestinal sound should be auscultated in 3 sections. Other intestinal noise present, what grade are they? If known noises and are heard, this called indicated in paralytic ileus. Palpation to detect muscle rigidity, muscle guarding, peritonism, reborn tenderness, and ascite. Percussion help to detection of the ascites and abdominal fluids. digital rectal examination for conditions such as palpable tumors on empty bowels caused by abstraction, such as ileus old tumor and blood. Complication of peritonitis is sequestration of fluid and electrolytes, as relieved by decreased central venous pressure. May cause electrolyte disturbance as well as significant hypovolemia, possible leading to shock and acute kidney failure. Next complication is peritoneal abscess. May form above or below the liver or the lesser omentum. It's localized. Next complication is sepsis. Sepsis may develop, so blood culture should be obtained from the blood. And next complication, complicated peritonitis typically involved multiple organs. Complicated peritonitis, multiple organs. Okay, student, and now we can talk about the treatment of acute abdomen and treatment tactics. Peritonitis is an absolute indication for emergency surgery. Absolutely indications. Preoperative preparation, these patients before the 60 minutes, administered antibiotics prophylaxis. Now in the slide you can see what is prophylaxis antibiotics. Maybe we can use cefuroxime, maybe amoxicillin, maybe other antibiotics. Preoperative preparation, antibiotic prophylaxis, 60 minutes before the incision. Next, preoperative correction of all dysfunction caused by contaminated pathology. Nasogastric probe into the stomach to evacuate the contents of the stomach before the operation. Catheterization of the bladder, of the urinary bladder. Yeah, and hygienic preparation of surgical intervention area. It's preoperative preparation, these patients. Next, treatment goals of surgery. Treatment goals of surgery: elimination of the source of peritonitis. Next goals: evacuation of pathological exudate, sanation and drainage of the abdominal cavity. Next goal: source control in case of abdominal sepsis, and damage control in case of injury. And fourth goals is elimination of disorders and restoration of the function of vital organs and system. In the treatment goals, surgical intervention. With peritonitis, with sepsis, it can be performed without sepsis. With peritonitis without sepsis, it can be performed by traditional and laparoscopic method of providers for radical elimination of the source. Anesthetic support is general anesthesia. General anesthesia. Student, in the slide you can see the drainage. drainage of abdominal cavity, drainage of the abdominal cavity with rational placement of drains in the supposed place of exudate accumulation. With widespread peritonitis in the subdiaphragmatic, subhepatic areas, left lateral canals, and pelvis. Options of completing the operation: adequate surgical intervention with complete elimination of the source can be complete by rational drainage and suturing of the abdominal cavity. At the appearance of the first signs of progression of peritonism or intra-abdominal complication requiring surgical correction, re-laparotomy on demand. Re-laparotomy on demand. It's the position of the important position of the surgical treatment by peritonitis. Okay, it's enough, and goodbye.